So what is ketamine therapy? So ketamine is originally, it's been around for many, many years. It's very safe. That is why it's such a great therapy to start with for people. The safety profile is impeccable, and there are very few side effects. The way that ketamine works, and they found this from putting people under for surgeries and anesthesia time and time again, and people would wake up from their surgery and be like, oh, well, that's fine, but like my depression's gone. Like, wow, I feel so grounded and feel like my anxiety levels are lower. And different anesthesiologists just kept seeing this over and over again. And so ketamine's been used for depression for years. It's just off label. The FDA still, ketamine is an anesthesia. Ketamine is an anesthetic, and that's what it's still regulated for. So, it is, I think, being just as much or more used these days for depression and anxiety. I won't get too much into the biochemistry of ketamine, but it is different than other psychedelic medicines, some of them, whereas it works on the glutamate system. And one amazing thing about ketamine, and I think this is why it's so helpful, and this is why I am so excited about the research, going forward, is it increases something called BDNF, which helps neuroplasticity. So I have a lot of work in the past that I've done with Alzheimer's patients and people preventing Alzheimer's that have the genetics for it. And BDNF is one of the main tenets of something that we're trying to increase BDNF because it increases neuroplasticity and kind of regrowing neurons in your brain and regrowing these connections. And so that is a really important part of the therapy as well. With the at-home ketamine, which is what I'm going to be using in my practice, the data coming out on that is amazing. There was a study, one of the online tech companies that is doing ketamine at home just put out a paper. 85% of the patients that are taking at-home ketamine have come with their depression scores have come down 50% after 6 sessions. That's incredible. We don't get that with SSRIs. The other thing about ketamine that I really like is it is safe to use with your SSRI. And so if you are on an antidepressant, it is still safe to use with that antidepressant, and we can then kind of tailor the antidepressants, and we can help you get off of your antidepressant medication using the ketamine. And that is totally safe because it's not as much of a serotonergic. Doesn't work on that system as much as some of the other psychedelic medicines do, and so there's no risk of serotonin syndrome and other issues with that. So it's, again, very safe to do at home. There is some very important, tenets, I think, that go with all psychedelic medicine, to make at-home ketamine therapy right for you. One thing that's very important is to have a trusted sitter. So you either need to be doing the therapy with a friend and you trade off and you sit with each other, because it is still a dissociative medication. So it's different than psilocybin or LSD or MDMA, where you're still really in your body. You are literally at certain, depending on dosages too, and everybody works with, does well with different dosages. Some people only need a very little amount to feel bliss and remind themselves that inside themselves they can create these happy, blissful thoughts and emotions. And so going with that really is helpful. But then some people need the higher dose where it gets to be a psychedelic dose. And everyone's so different, and it's kind of based on weight and height, but not really. So it's also based on psychedelic experience, and sometimes we don't know why, but some people will be on the really high dose and it's not as effective as the low dose. So it's really a personal thing, and I think it's important to work with a physician closely to find the right dosage for you, and then the set and setting. So you need to have the time and space for yourself. And I think ketamine, a huge part of the therapy of ketamine, that really is like a self-care modality. So you're making 2 hours for yourself, you're clearing your space, you're getting in the right mindset before you do the medicine, and taking that time for yourself every week or however often you can fit it in your schedule. It can be twice a week for 3 or 4 weeks. It can be once a week for 6 weeks, which is how most people can fit it into their lives. And the results are just outstanding for depression, anxiety, overwhelm. It, for spiritual health. People are using it to find, to remind themselves of the oneness of the universe. And some people have said they've had mystical experiences, even on ketamine. And so that can be a way to help with spiritual health as well as the mental health. And then, also some people are finding that after these therapies, certain physical health items can resolve as well. And, being an integrative medicine doctor, knowing how intertwined all of these things are, so much of our physical issues have to do with our mental health or our spiritual health. So it isn't surprising that, so many pain issues, ketamine is also just used for pain and chronic pain. So at-home therapy can work as well for chronic pain. So because chronic pain is often rooted in trauma, it's often, there's so many connections. And so it really is a very safe and very effective therapy. And I'm excited to bring it into my practice so that I can have a more holistic approach with all my patients.